private health sector is generally defined as all non-state providers, including for-profit and not-for-profit entities. These include hospitals, doctors, pharmacies, traditional healers, faith-based organizations, private health insurance mechanisms, as well as corporate philanthropic organizations created by the private sector for social responsibility. The private health sector has grown exponentially in most countries of the Eastern Mediterranean region, providing up to 70% of outpatient health services. The importance of the private health sector is increasingly being acknowledged by ministries of health.
لا يمكن لأي دولة بعد الآن أن تتجاهل دور القطاع الخاص أكان في تقديم الخدمات الصحية أو حتى في تمويلها.
Le secteur privé joue un rôle de plus en plus actif et il est en plus sollicité par les pouvoirs publics pour avoir ce rôle et contribuer à l'atteinte des objectifs de la zone.
In most countries, public health sector services alone cannot provide universal health coverage to the entire population.
Growing numbers of patients and limited natural resources have increased burdens on the public health sector and make it hard to accommodate with these challenges, particularly with the massive influx of refugees. Hence, partnership with the private sector, including NGOs, has not only become a necessity, but also an urgent need.
The private health sector could provide a unique opportunity for increased partnership and greater engagement and contributions towards public health goals.
2030 vision will focus on population's health and every sector, either private or governmental, will take the responsibility on the populations in the zone that they are covering.
The Ministry of Public Health contracted out the health service delivery in 31 out of 34 provinces to non-governmental organizations, and together we were able to have an impact on mortality rates and children under 5.
Universal and equitable coverage would require full engagement of the private sector in delivering a specific package of health services in an affordable, accessible, and acceptable manner. This is not always the case. In our region, utilization of the private sector is particularly high where public sector spending on health is low, resulting in underperforming or insufficient public health services. Surveys show that such limitations have pushed 63% to 85% of the poorest populations into paying out of pocket for the private health sector services. This has to change. Engagement between public and private health sectors requires deliberate, systematic collaboration of the government and the private health sector according to national health priorities beyond individual interventions and programs.
لا شك أن الاهتمام بالقطاع الخاص من خلال إدارات الوزارة هناك اهتمام ملحوظ من خلال وضع استراتيجيات تسجيل الشركات والمصحات الخاصة والمختبرات وكل ما يهتم بقطاع الصحة وإيجاد آلية وإطار قانوني ومناخ قانوني لهذه المصحات تكون تحت سيطرة وزارة الصحة كقوانين تشريعية كنظم كسبل سير العمل داخل هذه المصحات.
In doing so, there are several challenges facing ministries to engage with private health sector. Formal mechanisms to monitor the quality of healthcare services are weak or non-existent. Regulatory systems are weak or absent. There is no system to collect information from the private providers. And many physicians practice in both the public and private sectors. There is an urgent need to invest in building the capacities in ministries of health to design, manage, monitor, and evaluate public-private partnerships. To fill the gap, the WHO Regional Office has launched an initiative to strengthen member states' capacities in developing strategies for private sector effective management to achieve universal health coverage.
For modernization of public health sector, NPM policy, that is new public management policy, was adopted, and the core policies are going away from the policy which says what to do by government and going towards the policy which says how to do it better by government.
परफॉर्मेंस पार्टनरशिप है कि हमारे रिसोर्सेज, हमारे डॉक्टर्स, हमारे फंड्स, दवाइयाँ, इंफ्रास्ट्रक्चर वो हम प्रोवाइड करें उन लोगों के साथ मिलके जिनके पास एक्सपर्टीज़ है इस मैनेजमेंट को, सिस्टम को चलाने के लिए.
Public health sector remains the backbone of our health systems. Nevertheless, through a mutually agreed national policy framework and developing effective partnerships, private sector will become a partner in progress towards universal health coverage.